That's when you know it's serious. When you have these business groups or reading the room and seeing the rampant spread of the alpha and delta variant and deciding to kind of self-regulate, right, ahead of any kind of mandate or executive order from the governor. So that being said, we do have in our KUAM News Zoom room from the Guam Chamber of Commerce, Christine Boleto. From the Guam Women's Chamber of Commerce, we have Renee Logi. And from the Guamatown Restaurant Association, Mary Rhodes. Good morning.
Good morning.
Yeah, so anyway, like I was saying earlier this morning, it was like the whole pandemic, we were really fighting to try and keep businesses open and at 100% occupancy. And so it was like very sobering, for me anyway, to see the release come out from your groups where you're basically saying, whoa here, let's dial it back a little. And I know that this is something you had kind of hinted at a couple weeks ago, Mary. And so can we kind of just talk about the impetus behind this release? We'll start there.
Yeah, so a lot of it is because the social mandates that came out, social distancing mandates came back out in Executive 2021-21. It wasn't in 19 and 20. So the governor decided to reinstate social distancing at least at 6 feet and 3 feet for schools. So I think that businesses needed to know that with social distancing, everybody knows that that reduces how many people can actually enter and just the format of their business. And this is for the covered establishments that fall under these mandates, right? So as part of this education campaign to make sure everybody knows that public health has reenacted the social distancing mandate. We wanted to really, as organizations, reach out to the businesses and ask them to really consider whatever they can do within the confines of their facility or their establishment, understanding that social distancing mandates have been reinstated, that they consider whatever occupancy levels they can accomplish within the business setting in order to keep our community safe. And so the example of 50% was really because one of those, that's where we were prior to the lifting of July 21. It was actually 50% and then up to 75% and then eventually 100%. So it really was an example. We're not really asking everybody to across the board go 50%. We're asking everybody to consider their establishment, what they can afford to do within the social distancing mandates that are required and still practicing the 3 Ws.
Right, and if I could just jump in as well, Chris, this was something that, we were very clear with our discussions, and, it's unfortunate that people are interpreting that we're advocating for 50% because in some instances, it doesn't make sense, as Mary said. You have businesses that are able to maintain 6 feet social distancing without any reduction of capacity. They have individual offices for their employees, or they put up the plexiglass, they're implementing the social protocols or the safety protocols. So, and then in some cases with implementing the 6 feet, some businesses are down to 25%. So really the release was asking the business community to, remain vigilant, to ensure that the safety protocols are being implemented. And again, to take a look at their business, if it's practical, if it makes sense, to reduce occupancy. And if it doesn't make sense and they're able to keep their employees, their customers safe, then, it's fine to remain at 100%. The key there is maintaining the safety and ensuring the safety of employees and customers.
Rennie?
Yeah, agreed. It's just supposed to be a reminder to the community that we don't want to go back to the way things were before. So while we can, let's try and get ahead of it and be safe and do what we can. We can all do our part just so that we don't have to go back to a lockdown. Just be safe and work together.
Right, but how are businesses doing now? Because when the executive order, I don't know what the number was. It could have been the refined one.
The refined. Let me timeline this for you guys. So the governor came out, said, I'm going to restrict the movement of the unvaccinated, and said basically if you're unvaccinated, You can't gather outside your household. You can't, dine in. You can't go to the gym. You can't go to the movies. You can't go on the booze cruise. You can't go watch the dolphins.
So yeah, that's one.
Yeah,
Go
she
ahead.
refined it on Monday and then said, okay, if you got one shot, then we'll take you. But everything else still kind of stands. So I think what Serena's trying to say is that we're just hearing from everybody that since then, business has been way down. But, we don't know because that's just what we hear.
Yeah, we're hearing the same thing on our side. I think especially initially there was a lot of confusion from businesses, and of course there was a good portion of the unvaccinated that were upset with the mandate. We had stories on social media, an effort to ban establishments that were implementing, the governor's EO, which is unfortunate because I think, with businesses, there's some businesses that don't have a choice, that are still in survival mode. These last few months of being able to operate with full occupancy doesn't make up for a year and a half of being locked down with little to no revenue. So, there's still a lot of businesses out there struggling, trying to bring back employees, trying to keep employees, full time. So if they're implementing these things, it's not because they're taking a position, against the unvaccinated, but they're having to comply. But nonetheless, we are hearing that there's been, I think someone quoted 80% reduction, in those business establishments as compared to the week prior to the EO coming out. So we're hearing the same reports.
Yeah, that actually came from us because we've been doing a survey of all the businesses, and some of our businesses, especially the covered establishments under this EO, specific EO, they have seen a reduction in sales of 85% within just 1 week. But it's a multitude of things. It's not just the EO, it's the fact that PUA is ending, and a lot of that available income that people had, disposable income, is really going away. And with minimum wage increase, that took effect September 1, yesterday, there are a lot of things that are really going to cripple our economy. And as we were starting to see a resurgence of it, at least for the reopening, it's been there have been several challenges that have plagued businesses. And definitely this EO that was targeting towards certain businesses, that's why we said across all sectors, because I know that this EO really looked at covered establishments, but we're asking everybody to consider the social distancing mandates across all sectors and do what you can, because really the transmissions of the vaccinated, unvaccinated, the whole population. I really don't even want to have the conversations of vax, unvax.
Yeah.
It's really of the population. Those people are really are getting sick through congregation and other settings. So that's why if we can all do our part to reduce congregation, as well as just the number of people in a facility. I know that we've done this before and it worked really well prior to the lifting of restrictions. And so we're just asking people to have that mindset, knowing that we are very challenged with this surge. I mean, it's scary. The last week we've seen double digits. And it's going to continue for the next couple of weeks because it takes a while for those numbers to taper down. Yeah. And so I know that GHRA has been really going out there, and maybe that's where the confusion comes in, because we did use an example of 50%, but GHRA was working with the government and the PAG for that, because we did want to see a reduction, because we didn't want to see it only affect these covered establishments where mask comes off. We want it to be a fair across the board to all businesses. Mm-hmm. So right now, GHRA is really happy that we were able to work together with Guam Chamber of Commerce and the Guam Women's Chamber to go out collectively and just remind everybody that despite, in addition to the mandate of what's out there, we can all do our part, like as Renee said. And so I think it's going to take that. It's going to take a community effort to add additional mitigation strategies. And then also being very cognizant of the fact that, you know, there are people who are continuing to go to work, and we need to make sure if they're even asymptomatic, you know, if they've come in close contact, they have to go out and get tested. And so we're going to have to work closely together, as even those testing protocols are going to be required in the next couple of weeks. So there's still more to come for a lot of the businesses to have to be responsible for, and to have to, you know, provide these services, and much do like additional safety factors out in the community for, not, as Christine said, not just our guests, but also especially our employees, because we need to continue to have sustainability in order for our economy to survive this recent surge.
Well, so what's the plan to follow the governor's executive order for the mandatory vaccinations or the weekly COVID testing? Has the governor's provided, you know, the business community how this is going to work since she's mandating this, or is the business community just going to come up with their own plan? I know, Mary, you mentioned in your last interview that the governor wanted you to meet, or was telling public health to meet with you.
Yeah, we actually met on Wednesday, so or actually Tuesday. We met Tuesday afternoon, and we went over the different testing platforms of what's available. You know, we have the Binax antigen test, we have the Avid ID, we also have the PCR. And so we went over the different platforms that are available, and then what the quantities are available as far as inventory available on Guam for now. And then also what their strategies are with TIDSN and CHC, and then what we can implement for both the government as well as private sector as these mandates become effective on the 24th and 27th. So I have identified 3 strategies with public health, and so I'm currently writing out those SOPs. You know, we've had this in place, as Chima said, I believe in one of your interviews, that we've had this in place since December 2020 with public health with regards to antigen. And so it's really just opening up those SOPs and applying it across the board for both public and private sector. Some autonomous agencies have contacted me on what their plans are. And so I'm supposed to meet with public health tomorrow to outline those 3 strategies, whether businesses, government or private sector bring that internally, where they do testing at the workplace, or if we have stand up another site specifically with public health, or we stand up a different site for private sector, knowing that public health is already stretched, right? Because they do have capacity at TIDSN and CHC, they told me, but their protocols aren't using exactly what we're planning to use. We're planning to use the antigen testing, and then only if you test positive with that, which is a 15-minute result, and we'll be able to notify you within 15 minutes. You won't have to wait 24 hours. Then you can go get your PCR test. So we plan to meet with our HR managers and directors in the next week, and I've already mentioned to the chamber group, as well as the chambers, as well as Employers Council and SHRM, that we would open that up to all of the sectors under these covered establishments, so we can educate everybody on what is available with private sector.
Right. Mary, in mind. I know that we did talk with SHRM and Attorney Mike Pangilinan a few weeks back, and he was talking about like private companies. It looks like they do have the authority to put forth vaccine mandates for their employees. But has anybody in any of your groups kind of popped up and said, wait a second, I don't know if legally the government has the authority to mandate this on us? Because I know it's kind of interesting, because we are seeing that trend where businesses are mandating it with their employees, especially stateside, and it's starting to happen here. But were there any groups under your umbrella who said, wait a second, we don't think that they have the authority to do this?
Yeah, I've spoken to Attorney Mike Pangilinan, and what he gave out in your interview and with SHRM is it is allowable, but it's defined by the employer itself. And so the 2 cases that are listed, actually, the case law that are listed in the EO refer to the case in Houston, where the employees sued the hospital, but the hospital won that litigation, and then also the University of Indiana, but they were mandating their students and their employees. And so those specifically came from that employer, not from the state itself mandating private sector. So the employer, so I believe it can be challenged. I know there are 3 bills that are out there, and I believe the public hearing is tomorrow at the legislature regarding this, as well as the mandate. There are 3 separate bills regarding all of this. And so that's to be heard tomorrow afternoon at 4 p.m. There have been some employees that are really questioning it. And we have invited Attorney Mike Pangilinan to speak to our group as well, because in addition to not only requiring the vaccine, there are liabilities, right? You have to consider if you're going to be conducting the test yourself. You need a CLIA waiver, and public health has a CLIA waiver. The clinics have a CLIA waiver. And so, you know, those can be extended to businesses, but there are things that have to be put in place if that's going to happen. So those are things we still have to figure out. And so I hope, you know, we can come back when the plan is completely fleshed out and we can share it with everybody, because we have about 3 weeks before this goes into effect.
Well, I think it's been clear by you guys that, you know, businesses have been continuing to suffer during this pandemic. But I'm wondering if you guys gotten any update from GITA on their small business pandemic program. They announced it back in June. The applications were supposed to, I think they're coming out soon. I'm not sure when. Department of Labor also announced their program, their Business Para y Tautau program, also in June. But Dave Della Sola said that they were going to put that aside because they were going to move forward with GITA's program. Do you guys have any update?
So I've heard from GITA on that. The governor actually allocated funds toward that and has transferred the money to them. And so they're supposed to launch this month the application process. And, you know, it was communicated to us that, you know, rather than create confusion with people having to go and apply, for both programs, that they would start with the GITA one, which is, I think, at least the position of the chamber is that that is more beneficial right now in the immediate future, because it has more flexibility. It could be used to buy inventory, to bring on staff, to pay past due rent. And so that flexibility is needed, especially for small businesses, to be able to put that money where it's best served to try to, again, survive or sustain the business. I did have a chance to talk to David a month or so back. I can't remember when, but he's just waiting, after this round and hoping that there's funding going to be allocated for his program. And then that would be an additional help, especially if, or especially when, PUA recipients are there looking for jobs and we need to create jobs.
Yeah, that's this week though. And that kind of seemed like...
And so G-Tray actually was in that meeting with Chamber, and we did see the draft version of it, but I know GITA is planning to roll that out, but I was really hoping that both programs would get funded. I mean, we have $633 million from the rescue plan. I really wanted to see both funded, but I think Dave Della Sola has already come out and said that it's shelved for now. And maybe because, it was supposed to be, he wanted to time it with PUA ending, but considering the current business environment and climate, maybe shelving it for now isn't that bad, because I know if we could get people hired, closer to November, December, or January, if that program can be reinstated or actually launched, I think that the businesses can certainly benefit from that, from both GITA's program as well as Department of Labor's at some point.
Thank you. Renee, did you have anything to add in closing here?
Yeah, just about that program, we just agree that it's pretty much ready and set up. It's streamlined and could get the funds out pretty quickly. So we're hoping to see that come out pretty quickly as well. In addition, with everything going on with the EO, we are working on a FAQ page and a resource page on our website that should be rolling out very shortly, trying for this week, if not early next week. But that'll have some very frequently asked questions of what to do as far as the guidance memo. And we've been working with Mary, we've been working with public health, our business advisory task force, so that we can just make sure we have all the answers for the businesses available in like one specific area.
And how much is that Is the governor providing for the GITA program for the small businesses?
Believe it's like 30 million,
That's
if I remember correctly.
Is
Was
that-
it 30, Mary?
I think they revised it to 20, remember? They asked for 30.
Oh, okay.
Yeah.
should ask for 50. So 20 ARP.
But don't quote us because,
Yeah.
you know, anything's possible. It could be changed. Like
Yeah,
when we
it
were
could-
given the information,
Could be
it
changed
was
to 20,000 if you don't watch your.
Okay. Thank you guys. Thank you so
Thank
much.
you, ladies.
Thank you.
All right.
Sure.
Thank
Thanks,
you.
Bye.
everybody.
Bye.
See ya.
Stay safe.
Good morning.
Good for them.
Yeah. Yeah. What we're hearing, though, I was texting again Phil from the venue, and it's been just slow all around. And I think it's just a bunch of things. It's just that vax, unvax, can't do this, can't do that. But then it's also our community
Yeah.
doing what they have to do, which is
Mhm.
so. Thank you guys so much. It's 8:58.
But
Quick.
it's, and I really appreciate those three business communities coming together.
Yeah.
Even though there's there's no mandate to do it, but they're
Right.
doing it on their own.
Yeah, and that's because I think it's like pretty common knowledge that everybody feels like these restrictions that are currently in place aren't really targeting the spread of the virus. Which, remember, if we're concerned about the hospitals being they're already overflowing, then we got to stop the cases because those cases turn into hospitalizations. And so that's kind of what people are feeling, is that we're wasting time on this vax unvax when the data clearly shows that the vaccinated people are getting it, they're going in the hospital, they're spreading it. So really feel like the mitigation measures should be more across the board. I'm not going to get into the whole discrimination thing because I'm not really like keyed in on that side of the argument. I just think that across the board, if we can all get it and give it, then we all got to do the same things. We know it works. Back to basics, guys. Back to square one. It's 9 o'clock. We're going to take a break, and we're coming back with the director of Revenue.